My name is Mansoor Khan, and I'm American Board Certified Oncology-Hematology Clinical Pharmacist, holding master degree in clinical pharmacology and having 24 years of experience serving as Oncology-Hematology Clinical Pharmacist. So today I want to speak about the promotion of the second edition of the Fast Fact Biosimilar Handbook, authored by Professor Paul Carnes from UK, who is a great authority in the biosimilars. And this book is actually published by Kargar Publisher, where I had a chance to participate with a chapter introducing biosimilars in oncology hematology practice. The book will be launched during the ESMO 2024 annual meeting in Barcelona this week. The first question: why out of all topics am I talking about this now? Well, the cancer incidence is increasing globally. Oncology healthcare costs are escalating globally. And the only way we can reduce these expenditures is the substitutions of these biological reference products with the approved biosimilars, which probably can reduce the expenditures by about 30 to 50%, which can result in expanded access of these innovative biologicals to treat more and more cancer patients. And implementation of oncology biosimilar have provided significant cost saving and has served as a significant tool for oncology stewardship program in reducing financial toxicities. I have unique expertise in pharmacoeconomics and cost effectiveness management, having practiced in cost efficient use of healthcare resources in oncology over the past 18 years through my significant involvement in pharmacy and therapeutic committee and oncology formulary management, as well as my involvement in the clinical rounds and the tumor board meetings. Specifically, I have been instrumental in mass awareness and implementation of oncology biosimilars in oncology practice, which has resulted in expanded access to the oncology care nationwide. I've started working on awareness and implementation of oncology stewardship program in reducing the financial toxicities experienced by the cancer patients and societal burden of the cancer without affecting the clinical outcomes and the patient-reported outcomes. Later on, we have done many real-world evidence studies in our cancer center to evaluate the effectiveness and safety of the biosimilar, especially in extrapolated indication. And the results are reassuring that the biosimilars have similar effectiveness and safety in all indications. And we have addressed many concerns of switchability and extrapolation of the biosimilars across all the indications of the biosimilars when these concerns were raised by oncology clinicians. The next question is how and when did I get involved? Well, I was contacted by Professor Paul Cornes' team and Dr. Guy to participate with the Chapter 9, which is about introducing biosimilars in oncology and hematology. And it was a wonderful collaborative experience with the dedicated teams of editors. The next question is, has the process opened new opportunities or approaches in your other networks, other works? Well, uh, not really, as I'm already an advocate of the biosimilars and oncology stewardship program locally and globally. And I have many publications already in this area, but I have to acknowledge the fact that I have learned a lot from Professor Paul Carnes when I first met with him in 2017, and that was a significant experience that I have gained from Professor Paul Carnes. The next question is historical developments in biosimilar that change the course of care. Well, the development and approval of the biosimilars have definitely reduced the expenditures of the biologicals and enhanced the access of the patients to these cost-efficient biologicals globally. Now, what are the advantages in finance, regulation, and health? Well, the development and approval of the biosimilars have definitely reduced the expenditures of the biologicals. There had been very healthy competition between the industry of the innovators and the biosimilars, which has resulted in further cost reduction of the both versions of the biologicals. This cost reduction enhanced the access of the patients to these cost-efficient biologicals globally. The next question is there ever a case to rule out biosimilars where they are an option? The answer is generally not. However, there could be some situation where the supply chain, reputation, country of origin of approval may have some negative impact, and we have witnessed some of these experiences in the past. Now, why should someone read this book? The most important question. Well, what we have seen in the studies that healthcare workers, they generally have misunderstanding or misconceptions, or they have limited knowledge about the biosimilars, and most of the clinicians, they usually generally do not differentiate between the biosimilars and the generics, and that can result in a negative impact and nocebo effects to the patients. So the studies have shown that the understanding of the biosimilars is low, and the educational needs of the clinician about the biosimilars are high. There was one study that I recently came across. It was conducted in the United States, and the survey was conducted to the American Society of Clinical Oncology pool, and many oncologists, more than 50% of oncologists, they did not know uh, the true definition of the biosimilars, or they could not provide the satisfactory definition of the biosimilars. Therefore, it is imperative to increase the healthcare workers' awareness about the biosimilars use before actually addition of the oncology biosimilars to the institutional formularies and prescribing them to the patients. It is evident that the biosimilar education activities should start with the basic fact about the biosimilars and progress to address more complex aspects such as switchability, extrapolation, principles of biosimilars, and interchangeability issues to develop comprehensive understanding and perception of the biosimilars among the oncology clinicians and other clinicians treating biosimilar in autoimmune diseases, gastroenterology, rheumatology, etc. Hence, the healthcare workers can increase the knowledge and understanding about the true perception of the biosimilars after reading this book. This will be able to this book will be able to help them understand the true definition of the biosimilar, which is very important. And once they will have the education, so they will have the confidence in the biosimilar, they will be able to convey the same confidence to the patients and will not have any negative impact or the nocebo effects to the patients. So, who should hear this and what should they know after listening? Well, the physician treating different diseases with biological medications, pharmacists, nurses, and other healthcare professionals involved in the use of the biological medicines for patients, they should definitely read this book. They will learn a lot by reading this book. So they will be able to understand the principles of biosimilars and will be able to address the practical issues of switchability, extrapolation of the indication, interchangeability, and most importantly, pharmacovigilance of the biosimilar drugs. So they will be able to differentiate biosimilars from the generics, as we said earlier, that in one of the study, a couple of studies actually, I have seen that oncology clinicians and other clinicians, they did not know the true definition of the biosimilars. So where can the listeners find more? So listener can find more information on the biosimilar guidance published by European Medicine Agency, which is called EMA, and United States FDA. They can search for published studies in peer-reviewed journal. One of the famous journal on the biosimilars is Gavi, and there are many other medical economics journals which actually publish a lot of literature on the biosimilars. So, reading this book will definitely increase the awareness of the healthcare workers about the biosimilar and instill the confidence in them, and they'll be able to pass the confidence to the patients and hence will avoid any nocebo effect. They will be able to appreciate the cost saving offered by the biosimilar, as resultant cost saving will open new avenues treating other patients with other innovative therapies. And I wish you good luck and enjoy reading this book and increase your knowledge about the biosimilars and implement the biosimilars in your institutional formularies and reduce the expenditures. And this will definitely open the new avenues to expand the access of these cost efficient biologicals to treat more and more patients in your institution. And thank you.